Would you know what to do if one side of your face drooped, if you had trouble lifting one arm, or if you or someone close to you had slurred speech? Would you know to dial 911 immediately? What I've just described are the symptoms of a stroke. This is not just a disease of old people. Strokes are happening more often in younger people, and May is Stroke Awareness Month. Kathy Howard was 55 when she had a stroke. And Kathy, did you have these symptoms?
I did not have these symptoms. Where my stroke was in the brain caused different symptoms. I had more of a visual issue than no face droop, no arm, none of that. And I was in the hospital for quite a while, and the stroke happened in the hospital.
Wow.
Yeah.
And that was 10 years ago. How are you today?
I'm great. I'm walking unassisted. I still have a few little invisible deficits, I guess you could say. But overall, living life wonderfully.
I'm so glad. Dr. Randall Edgell is an interventional neurologist at SSM St. Louis University Hospital. There's something called time-critical diagnosis. What is that, and did it apply here in Kathy's case?
Absolutely, yes. The time-critical diagnosis, the brain really is the most sensitive organ in the body to a lack of blood flow. So in the moments when that artery is blocked and a stroke is happening, the brain is literally melting away in front of our eyes, and the patient's whole personality can be changed in those moments. And so it's absolutely crucial that patients and families immediately recognize the signs and symptoms of stroke and get patients to the right facility in a timely manner. There's even a state legislated process for designating stroke centers, which is referred to as the time-critical diagnosis organization around stroke, so that first responders know which hospitals are capable of providing treatments like tissue plasminogen activator, a clot-dissolving drug, or procedures to remove clots from the brain.
And like a heart attack, those minutes really count, right?
Absolutely. I think that we have, luckily, a window of time which is getting slightly larger, but still 3 hours for the for the best results is our window.
So Kathy, in the years since your stroke, you have started ABC Brigade. You're a huge advocate and support group for people with stroke. Tell me about what you're doing.
Well, we have several programs that we offer. It became very clear to me 10 years ago that a lot of us would go home after therapy, and that's where we would be comfortable, and it's probably the worst thing we can do. So we have we try to add a program every year. We have a program called Coffee Cafesia, which is simply a little coffee house for people who've lost their speech due to stroke. We started a chorus last year, the Aphasia Bridge Chorus. We're getting ready to start a Young Survivors Club, which is more of a social club. They deal with a lot of different things than the older people do. You know, our Stampede for Stroke, which is kind of our Olympics every year for stroke survivors. So
that's your annual walk?
Yes.
You have done so much in that 10 years since you had a stroke, and the community is so grateful for everything you've done.
I've had a lot of people inspire me to get me there.
Well, if you're at home, you know somebody who's had a stroke, or you're a survivor, ABC Brigade will have a link on our website. Look for this story on KSDK.com. Keep up the great work. Aphasia, by the way, is the speech impediment or speech issue that can arise after a stroke.
Right.
And so important to continue to reach out to others.
Just
even
don't
if you
give
have
up.
That.
No matter how bad your diagnosis is at the beginning or the prognosis is. I had a very bleak prognosis, but I'm here to tell you your life is not over.
Thank
after
you so
stroke.
much. Kathy Howard, Dr. Randall Edgell from SSM Health, St. Louis University Hospital. Thank you both for being here. Scott Connell's got a look at our forecast.
Awfully bright outside right now, and we'll definitely take that bright sky around the St. Louis area. We're looking out in the Chesterfield Valley. Traffic's starting to pick up on 4064 right now. We do have some high clouds and a couple of puffy clouds, but what we've noticed this afternoon in general is those puffy clouds haven't been growing all that much around St. Louis. The air is a little bit drier today here in St. Louis. You go a little farther south and we pick up a little more humidity, and that's tending to limit, at least in the metro area, our chances for showers. This basically right now is just ground clutter around St. Louis on the radar screen, so that's all just typical, not rain. Now we look down to the south. There was a little area right here in Jefferson County. I'll zoom in there. It was moving a few minutes ago, so that looked like it was a little brief shower that went through Antonio. Now it's dropping onto the south down Old Lee May Ferry Road, so maybe a few sprinkles there. A little farther to the southwest of St. Louis, we head down towards Rolla. This has been a pretty good gully washer here, especially just north and west of Missouri S&T here as we look at some of that heavier rain and occasionally